Good afternoon, everyone. I'd like to call this meeting to order. It's been a long time since I've done this, so bear with me. We're going to start with roll call. Ms. Sheba, please.
Ms. Bernard,
Here in Monroe County.
Mr. Cowan,
Present.
Mr. Furman,
Present virtually in Troy, Michigan. Sorry, I was muted.
Dr. Guadalupe, Dr. Hans, Mr. Landsman, Ms. Namie Dyer, Ms. Root, Dr. Todd,
Here.
Mr. Torres,
Present virtually in Waterford, Michigan.
Ms. Newman,
Present.
I have 6 board members present. That we have a quorum with 6. We have 11 board members.
This is our first opportunity for public comment. Do we have any public comment?
Good evening. We do not have any public comment in the online form, but we do have a second opportunity at the end of the meeting for public comment. Thank you.
Thank you so much. Next, we will go on to our business operations portion of the meeting. Ms. Mamie Dyer is out of town, so I'll be conducting the business operations for this session. First, we have our financial review.
Good evening, everybody. Please tell me if you can't hear me. Thank you. So we are looking at your first glance at fiscal year 22. So remember, this is going to be very, very early in the year, and you're going to see definitely some things that look like they're lagging because of that, because things like fee schedules and all those types of things take a little time to get in the first of the year, and then so there's a bit of a delay in billing at times. So you're going to see that in here. But what you can see in this first slide is that revenue is up pretty significantly even over last fiscal year at this time. So at last fiscal year at this time, we were caught up with all of the direct care wage funding and had all of the adjustments that they were going to make. But what you're seeing going on here is really a couple of things. Is partly because we're still under that emergency order where no one falls off of Medicaid. So that's anybody that comes on is just then on. So that's definitely accumulating and having a significant impact on our revenue. The other thing you're going to see this year, which we will probably in Budget Amendment 1 start to separate out a bit, is the revenue from Ccbhc. So Ccbhc is Certified Community Behavioral Health Center, and both CNS and Easter Seals are Ccbhcs. And so the way they fund us for that is basically it's an estimate of all of the people in our county that qualify for that particular service. So we then push the money through to those agencies and reconcile it annually. So those couple of things are making the revenue so significantly higher than last fiscal year, along with, if you recall, the direct care wage increase was also going to go up to $2.35 this fiscal year. Right now, the only thing that's in our rates, I believe, is $2. We're still waiting for the adjustment of the 35 cents. So we can thank you. So this is looking at the eligibles. So this ties to the what I was mentioning related to eligibles are just really continuing to increase. So in 20 years, I have never seen eligibles that high. So you can see we're pushing, what is that, 250 right there, 250,000. So it's a lot. It's a lot more than historically. We used to stay right around 120,000-ish, but again, because we're now on year 2 or going on year 3 of the emergency order, they're just continuing to accumulate. So from a revenue perspective, that's great for us. It definitely makes it so that because we're funded by the number of eligibles, we definitely get a higher amount of revenue because of that. Next slide, please. Okay, so this is just comparing last month to this month. And so you're not going to see material differences because much of what needs to happen for last month hasn't been done yet. We're just beginning those processes. And again, fiscal year 22 just getting started, and people likely won't have billed much yet for October. So it just takes some time to get caught up and kind of on a roll for the next fiscal year once contracts and fee screens and all of those things get in. So you can see cash and investments isn't much different. Receivables isn't much different as well. Other assets and capital assets are relatively flat between last month and this month. So liabilities, you can see vendor payments are down slightly. That's really just a timing issue. Those fluctuate back and forth. Due to state isn't materially different, nor is employee payables or long-term debt. Total assets, again, is going to be roughly the same because we're comparing just this month to last month, as opposed to as we go throughout the fiscal year, these things will be cumulative. Total liabilities are down slightly, and then total net position is up just slightly. So revenue comparison, so this is year-over-year comparison, and so we saw that in that very first chart where we could see the difference in the horizontal blue line versus what we got this month, which is up, and for those reasons I mentioned. General fund is actually slightly lower because we're still in the phase of implementing that reduction that they were spreading over, I think it was a total of a 5-year period. So we did get that reduction included in this year. County funds is exactly the same, and then all other is roughly the same as well. Expenses, you can see administration. It looks like it's up slightly, but that actually, it looks like administration for October looks off from my perspective, so I need to go back and look at that. Provider network, you can see is up a bit through October compared to last October. But again, that's really going to be related to not only the number of people served, but also all of those adjustments we've been doing related to direct care wage. We're also now pushing out that additional $1 that we did push out, so that's included. Grants are roughly the same, as well as all other expenses. So total revenue is up, total expenses are slightly up compared to last year, and net income is still, the net of those two things is still up compared to last fiscal year. These are our top 15 providers paid throughout the month, as well as the amounts, and with that, I can take any questions.
Are there any questions online for Anya? Hearing none. Oh, Hadass. Go ahead,
Hi,
Hadass.
Anya.
Hi.
Thank you. So that was great explanation. How are you going to let us know about the proportion of the follow-up on administration? Are you just going to email us, or, to see the
Yeah, so I can
difference?
go back in and look into that and have that note maybe sent through Boardable. I just want to look at that number. It actually looks like the prior month was off, not this month.
Oh, okay. Thank you.
No problem.
Are there any other questions for Anya on the financials? Hearing none.
Okay, thank you.
Thank you. Next, we have the, contracts, and these are all approval items for the Business Operations Committee. First up will be the Thunder Mop Extension Board approval. And who is presenting that? Oh, I'm sorry. Hello.
Hello, good afternoon. Yes, what I'd like to do is to present to you the Thunder Mop extension, which is our janitorial contract, for consideration of an additional 90 days extension. This agreement with, we recently penned an agreement with Italian to begin janitorial services. That was supposed to begin back on November 1st. Unfortunately, they were unable to meet that deadline, and an extension was granted, and they were unable to meet that deadline. As a result, we've determined that the best thing for us to do is to move on to the runner-up, the next organization who did the best in the bidding process. So this evening, I'm requesting a 90-day extension of the current contract so that we can begin that process and choose another vendor at the end of that. As you can see from the document, let me make certain I'm looking at the right one, that that 90-day agreement will be $120,000. That's actually including the previous extensions. So this extension of 90 days is in fact around $66,000. So with that, I'll take any questions.
I'm sorry, what was your name again?
Richard. It's Richard Oldacre. I'm the Chief Operating Officer.
Hadn't had a chance to meet you face to face. Thank you, Mr. Oldacre. Are there any questions for Mr. Oldacre on this Thunder Mop contract? If there's no questions, then the Business Operations Committee needs to...
I have a question.
Okay. Go ahead, John Paul.
This is John Paul. Sorry. So the contract extension is as to the runner-up, is that, am I understanding it correctly?
No, the extension is for the existing janitorial service. So we're extending their contract because they did not win the bid, but they were still active. They continue to provide services at both locations currently. So we need coverage until we can install a new vendor. And so the 90 days, they will continue to operate for 90 days, which is this extension. And then the new vendor hopefully will be in place at the end of that 90-day period.
Okay, and then we did select the new vendor then as the second runner-up, is that correct?
I did not hear the question.
Oh,
Could you repeat your question?
Yeah, I'm sorry, I'm hearing an echo when I talk though. So we did obtain or make a choice on the second runner-up to provide the contract to?
Yes, the bidders were ranked at the end of the process. So at this point, that's the legal department is handling that component. So we're going to basically go down the list based on how folks were ranked at the end of that process and follow our procedures to inform them and give them the opportunity to respond if they are able to, if they're still interested and they are able to meet our conditions, then we will begin contractual negotiations with them with the intent to begin in 90 days' time.
Okay, so then the questions with regard to the next organization or runner-up then would be better saved at a different time then, correct, when we look at that contract?
The contract will be exactly the same.
Well, I just have questions about the organization. I know how it's ranked, and you go down the line. So the next one scored next best, so that would be who we're going to. But my question is, with regard to that organization, has anybody involved with the bid process, or anybody who was on this committee, have they had any experience with that organization, or have we checked references for that organization?
I will be able to get back with you on that. I do not know that we had the need to check references. They would have provided references as part of the RFP process, but now that they're actually being considered, I would think that now is the time when we would actually, in fact, check their references. So there was no need to do that prior to.
Yeah, that's what I was just trying to get at. I was trying to figure out at what point where we're at, but I see. Okay, so we're just extending the current with the current provider, and then we'll move forward with selecting the next, and then go from there. Okay.
That is correct.
Okay. All right. Thank you.
You're welcome.
Mr. Torres, I don't know what the problem is, but you kind of keep fading in and out when you're speaking.
Oh, do I?
Yes. It's
Yeah,
hard
I'm on
to
Bluetooth,
hear.
but I'm hearing the echo in the room when I talk. So it's just technology issues, but I'm on my Bluetooth. But I am hearing the echo from probably the speakers in the room, so it's hard to talk.
Is it my mic?
So at this point, do we need to have a recommendation from the Business Operations Committee to put this forward for board consideration at the meeting? So I would need a motion from one of the members. Mr. Cowan has made that motion. Is there a second from Business Operations?
Second from Hadass.
Thank you. Is there any discussion on the motion? Sheila, could you call the roll, please?
I can. Ms. Bernard,
Yes.
Dr. Hans, Ms. Namie Dyer, Mr. Cowan,
Yes.
Mr. Torres,
Yes.
motion carries.
Thank you. The next contract under consideration is the American Guard extension approval.
Yes, you have within your packet the information, the American Guard Services. This is our existing security services. This is a 3-year extension of that agreement. In essence, what's changing here is that we'll be adding additional security to the RCC facility to account for the crisis center once that center is up and running next year. Not much else. They will continue to provide services. We've been very comfortable with their services thus far, and so we'd like to continue for another 3 years. Thank you. Or any questions?
Are there any questions for Mr. Odaker on this contract? I'm not hearing any questions, so is there a motion to bring this forward to the full board for approval from Business Operations?
So moved.
It's been moved by Mr. Cowan. Can I get a second, please?
Second
from
by
business.
Hadas.
Thank you. It's been moved by Mr. Cowan, seconded by Ms. Bernard. Are there any questions on this motion? Hearing none, Sheila, could you call the roll, please?
Sure can. Ms. Bernard?
Yes.
Dr. Hans? Ms. Mamie Dyer? Mr. Cowan?
Yes.
Mr. Torres?
Yes.
Motion carries.
The next contract for consideration is the MMRA Renewal Board Approval.
Good evening, good afternoon, actually. I'm here to present the renewal for the Michigan Risk Management insurance policy. It's a one-year term. Contract amount is $111,612. The previous contract amount was $106,315. It's for risk management insurance that covers all of the OCHN properties and facilities, as well as people. It's liability insurance. I believe that Jonathan asked the question whether or not it covered the board members. Yes, it does cover board members for liabilities, for omissions and errors, anything liability related. And then there's a separate policy for the medical director for malpractice that's not covered under the MRA, but it's covered through Pro Assurance is the provider for that contract. So we just want to renew this contract for an additional year. We've been with risk management since 1999, and they've been providing good service for us. We'd like to recommend a renewal. Are there any other additional questions? Yes.
I have,
Mr. Cowan?
it's not a question as much, could you or someone forward to us in the package for the board meeting next week a list of the coverage amounts, the limits of liability? It's usually a standard page that's included with any insurance coverage. And specifically, I want to make sure, I want to see the board coverage. That's probably, I'm sure everything's fine. I just want to see it because it's my first time I've ever looked at it. So if you could send those two things along, that would be great. Thank you very much.
Okay, no problem.
Are there any other questions on this contract? Hearing
I have a
none,
question.
go ahead, Hadas.
In addition to sending the information that was just requested, I'm just curious, is it possible that we could see how often, if at all, we've used this in the last 5 years? It's kind of a history.
What was your question again? I didn't hear you.
If we've had to use the insurance in the past 5 years.
We have had to use it. We have used it in the last 5 years, but there is, we do participate in this group insurance that allows us to receive net asset distributions each year. So we usually get back probably up to 30 to 40% of our premium in net asset distributions each year as a benefit of being a part of this insurance group. When there's low claims and when you have a premium amount and you have few claims and you're very risk averse, they reward you by giving you a dividend or a net asset distribution, and it's giving you back a portion of your premium. And so it incentivizes the group to keep claims at a minimum.
Okay, and so is the premium that you're discussing the proposed contract amount or a different amount?
The premium that I'm talking about now, The $111,612 is the proposed contract amount. The premium or the net asset distribution that we get is not included in this conversation.
Okay, thank you.
Okay.
Are there any more questions on this contract? Hearing none, I'll entertain a motion to move this forward for full board approval.
So moved.
Moved by Mr. Cowan. Is there a second?
Second by Mr.
I'll
Bernard.
second it, John Paul.
It's been moved by Mr. Cowan, second by John Paul. Any other questions on the motion? Hearing none. Sheila, could you call the roll, please?
Mr. Torres?
Yes.
Mr. Cowan?
Yes.
Ms. Mamie Dyer? Dr. Hans? Ms. Bernard?
Yes.
Motion carries.
I see Mr. Lansman has joined us. Did you want to oversee the portion of the election for Vice Chair of Business Operations?
I could do that if you'd like, but it sounds like you have the process well in hand. I was
Thank you, sir.
just wanted to raise my hand and announce that I am on the call and I am remote from West Bloomfield.
Thank you, sir.
Thank you.
Welcome to the meeting.
Appreciate it.
The Business Operations Committee currently does not have a vice chair, and so this portion of the meeting is set aside for nominations and hopefully a vote to secure a person in that position. Business Operations. Does anyone have a nomination for vice chair for your committee?
This is Ms. Bernard. I would like to nominate John Paul. I think he's on the committee.
Mr. Torres, do you accept the nomination?
Yeah, I'll accept the nomination.
Are there any other nominations for vice chair? I'm not hearing any other nominations.
I just need a roll call vote.
Okay.
Ms. Bernard?
Yes.
Dr. Hans? Ms. Mamie Dyer? Mr. Cowan?
Yes.
And Mr. Torres?
Yes.
Motion carries.
Thank you, Sheila. Congratulations, Mr. Torres.
Thank you.
Next, we'll move on to the Business Policy Management Committee portion of our meeting. And we have a review of our annual plan.
Good evening. Hi, my name is Frances Carley, and I'm the Deputy Director for Strategic Initiatives at OCHN. So to begin, I would like to thank the Board of Directors and our CEO, Dana Lassenby, for the opportunity to share this update on the organization's FY21 annual goals and objectives. I'd also like to thank my OCHN colleagues for all of the contributions that they've made to this presentation over the past couple of weeks. When developing a presentation to capture a year's worth of work, the biggest challenge I found was in narrowing down what to highlight. As a newcomer to OCHN, I was struck by the number of people who receive services here through the network and also by the number of services and projects that are in place. So this is my attempt to tell the story of all the work that goes into keeping a community behavioral health network not just up and running, but also thriving. So at the heart of this story, of course, are the people served, and they are the reason that OCHN exists. Hopefully this presentation captures the scale and the extent of the staff's accomplishments in FY21, and also demonstrates how a community behavioral health agency is distinct from an insurance company or a pass-through administrative organization, because it is so much more than that. So to start, we have an overview of the total number of persons served in FY21 by population. Beginning with the top section of the chart, you'll see that more than 3,600 people received SUD, substance use disorder services. More than 4,300 people received services for intellectual or developmental disabilities. 3,700 individuals received crisis services. Over 2,700 children with serious emotional disturbances were served, and over 12,000 adults with mental illness were also served. So the total count of persons served was 21,456. That's the unduplicated count. Next, we have a few highlights from the provider network showing some additional details about the range of programs that were offered. To the left, you'll see some notes about a few of the service models and other special programs that OCHN supports. In FY21, there were 400 or so enrollees in the autism benefit. 71 children were enrolled in the severe emotional disturbance waiver. 728 individuals enrolled in the behavioral health home model. And this is an all-ages model for individuals who have Medicaid and are either living with a serious mental illness or a serious emotional disturbance. Staff also worked on launching the Certified Community Behavioral Health Center demonstration, and Oakland County sites for the demonstration are Easter Seals and CNS. Next to the right are the number of people served by a few specific programs. And again, this is just a snapshot. So for example, on average, about 200 people were served each quarter by the clubhouses. Over 770 people received peer support monthly. And 350 adults received targeted case management each quarter on average. There were about 450 intensive crisis stabilization encounters. 158 individuals per month on average received employment and independent living supports. Then finally, nearly 3,500 people, unduplicated persons, received SUD services, including residential treatment. So next, we have a few highlights regarding encounters and performance outcomes. In FY21, OCHN served over 21,400 people through more than 1.9 million encounters, and this was despite the challenges posed by COVID-19. For outcomes, OCHN continued to make progress on national performance standards and measures, including the HEDIS measures as part of the agency's accreditation through NCQA. Notably, OCHN's performance exceeded the national average of both commercial and Medicaid HMOs for a couple of HEDIS measures. OCHN exceeded the HMOs actually by more than 30% for each of the following measures. Those are follow-up after a hospital visit within 7 days, and follow-up visits for children who were prescribed ADHD medication. And OCHN is currently in the 90th percentile for follow-up after ADHD medications are prescribed. And then finally, another outcome that's related to OCHN's value-based purchasing model is that the assertive community treatment model has reduced inpatient readmissions by 65% since 2019. So next, as a public mission-focused service agency, OCHN provides several notable direct services in the community. Due to OCHN's role in the region, staff are uniquely positioned to collaborate across county agencies and providers and to bring in support from both state and federal partners as well. For example, OCHN's nursing staff provide focused integrated healthcare coordination for individuals with exceptional needs, efforts which have resulted in a 71% reduction in hospital stays and a 32% reduction in ED visits for individuals who had 5 or more ED visits in the previous year. OCHN also served as a safety net by covering treatment costs for 218 people in the county with substance use disorders who actually had private insurance, but it wasn't sufficient to cover their treatment needs. Additionally, the Veterans Navigator served 165 veterans who were residents of Oakland County in FY21. Other services include the Access Team, who provided over 7,700 clinical screenings for callers, and the Justice Initiative Team, who facilitate an average of 600 jail diversions a year. Training staff also supported the autonomy of persons served by training their family members and support staff in the supported decision-making model. So next, I'd like to touch on how OCHN is able to leverage its position as a centralized community health network to bring additional funding streams into Oakland County. Although OCHN does not have a dedicated grant writer, staff take the initiative to write and manage grants every year, impacting people served across the provider network. 2 examples of grant-funded positions through OCHN are the Veterans Navigator and also a healthcare coordinator who is outstationed at Honor Community Health. Staff also secured federal funding for Children's Crisis Stabilization Services and funding to mitigate the impacts of COVID-19. As a regional coordinating agency, OCHN plays a critical role in providing frontline crisis response in FY21 with COVID and most recently in Oxford. First, OCHN wrote grants for and obtained funding to address the pandemic. Staff coordinated the distribution of PPE to individuals served and the provider network. Next, OCHN was awarded funding to buy air purifiers and COVID test kits, which will go through the procurement process for distribution in FY22. OCHN also held vaccination clinics for persons served between the OCHN clinics and the clinics that were hosted by providers. More than 2,100 individuals were vaccinated. So before moving on, I guess I would like to pause for any questions.
Hadas has her hand up.
Go ahead, Hadas.
Sorry, I was muted. Okay, so my first question is about on page 23. It says 158 approximately individuals per month received employment and independent living supports. So this is interesting to me that it's the same number, because one, trying to receive employment versus independent living supports. I just wondering maybe you could at a later time give us more detail on what agencies did the independent living supports and what agencies did the employment portion.
Yes, absolutely, and I can get the monthly breakout by provider.
Okay, thank you. And then the other thing is, since we received so much, this is just a sort of a general question, so much more funding for Medicaid this year than the year before, and you gave us, you know, the total of 21,456. Do you know for the previous year how many people we served? Obviously, it's different because it was COVID and you can't really compare, but just due to funding, if you could let us know, you know, what was that difference in the number we served?
I can look into that and provide the response.
Okay, great. And then I have another question, which is on page 25. Let's go to 25. So on the right side, the 75 individuals received housing support. So I'm wondering, those 75 people, how many of them are actually in the homes that OCHN owns? So I was just, if that's a possibility to figure out too.
I will follow up on that one as well.
Yeah. And then compare it to the previous year too. How many people we received housing support? And I'm not quite sure what housing support means. If that, maybe you could also define that when you look it up. If it means, you know, finding them a house, or if it means paying, I don't actually know what it means exactly. So maybe define what housing support means. But this is great. Thank you so much. Those are all my questions.
Okay, great. Thank you.
Are there any other questions? I had two. I don't have the page numbers of your PowerPoint. I didn't get a copy of that. But under the behavioral health home, it was 728 participants. Was that program all year long, or was it a portion of last year? I couldn't remember.
I'm not sure if anyone from the clinical team could address that question
A
right
head
now.
nodding in the back of the room.
Hi, I'm online. I can take the question. Yeah.
Real quick, it was all year. We started from zero and actually are the highest in the state currently for the number of persons enrolled.
Okay, thank you, Anya. And thank you, Dr. Posio. My other question was the 700 people that received peer support services last year. Did the core agencies meet their goals for peer support, or no? Isn't that incentivized?
Some more detailed information. If Vicki is available to speak to that more directly right now, we could answer that question, but otherwise I would have to go back and look at the information she sent me.
Thank you.
Myself or Jillian to the answers. Jillian, do you want to take that, or you want me to?
I don't have the exact data in front of me, which we can certainly provide to the board. Some providers did meet their goals for peer support and others did not.
So we'd be able to get access to that information?
Yep, we can share the quarterly report data.
And along with that, I'd like to know what some of the challenges are for the ones that aren't meeting, since some are and some aren't. Thank you.
Mm-hmm.
Are there any other questions before she goes on with her report? No. Hadass, your hand's still up. Did you have further questions?
No, I'm sorry. I'll put it down.
Thank you.
Okay, so moving along to the next slide, please. With that, I'd like to set the stage with an overview of the strategic priorities that were established for fiscal years 19 through 22 and the 20 annual goals that were identified under each of these priorities for FY21 specifically. The slides that follow include an overview of these 6 strategic priorities, and then from there, we'll go into greater detail by discussing some key goals and outcomes by department, including the status of the work. So this particular goal setting and reporting process, just to set the stage and make sure that everyone is aware, this was a new process for this particular process and the way that the goals were recorded and set up. This was a new process for FY21, and it was helpful for capturing goals and objectives for the year, but there are some areas for improvement going forward, and we're considering this to be an iterative process where we'll continue to build on the lessons learned from this year and then onward. A full report is pending, which will discuss the programs and services in more detail, and the final version will be made available. I have a draft in progress. The final version will be made available when we have the audited financials later this winter and are able to include the budget outcomes as well. So with the next few slides, I would just like to quickly review the strategic priorities and so that we have more time to go into the detailed slides for each department. So first, the key strategic priorities under administration and operations focused on accreditation, value-based contracting, and provider network development and management. This is a broad area that encompasses most of the, if not all, of the departments. And within this set of priorities, there were 6 key FY21 goals and 166 objectives. Next, in FY21, advocacy and empowerment focused on civil rights and supported decision-making and community education goals, which included 33 unique objectives. In FY21, the annual goals of the budget and finance area focused on budget planning and implementation, funding advocacy, and provider funding, and it included 38 objectives. And then under the healthcare and wellness priority, OCHN focused on 2 goals and 4 objectives in FY21, including the implementation of the behavioral health home model, which we discussed, and reducing unnecessary ED and hospital visits. For supports and services, in FY21, OCHN focused on 6 goals and 19 objectives that address the social determinants of health, justice initiatives, diversity, equity, inclusion, and those among other priorities. And then in FY21, technology and innovation was focused on improvements to health information and data exchange, as well as public transparency and outcomes data, which included 20 objectives. Okay, so now we'll move into a more detailed dive into each department's goals and an overview of the results. Each of the 11 departments shown here have 1 or more slides dedicated to the accomplishments and the work that was completed, as well as 1 slide showing the work that was still in progress as of September 30th. So we'll start with the clinical practice team, whose work includes integrated healthcare initiatives, the work of the clinical analysts, and the utilization management and review teams. So in order to orient everyone to the way the tables are set up, this table is laid out to show the relevant strategic priority in the left column, The department goal that corresponds to the priorities are shown in the next column over, and then the status of the goal, where everything was at the end of FY21, is also in the third column. Just for the sake of orientation, the goals can include one or multiple objectives within each goal. But for the sake of clarity, I did not include all of the objectives and list them out. Then finally, on the far right column is an overview of the key accomplishments within each goal. So the clinical team had many significant accomplishments in FY21, starting with the launch of the behavioral health home model, and OCHN had 7 partners in the model, and as Anya said, led the state in enrollment with a total of 728 individuals of all ages. To address the number of hospital and ED visits, OCHN developed 56 new shared care plans with the Medicaid health plans, and also hired a full-time dedicated peer navigator to support people with complex service needs. Another key accomplishment was training provider organizations in suicide care and prevention, and training staff in the diversity, equity, inclusion facilitators model. So next on this slide, here you'll see a summary of the work that is still in progress. First, although the team conducted trainings on person and family-centered training, the goal in FY22 is to conduct trainings throughout the entire provider network. Additionally, the team continues to work with IT to determine the best way to obtain data on labs for persons served, in order to better track healthcare outcomes and care coordination for people with exceptional needs. And then here I will pause to see if there are any questions for the clinical team before we move on.
Are there any questions online? I don't have a question, I just have a comment. The slides are kind of small. I'm having a hard time reading them. That would be helpful. Because when I printed out the packet, this part didn't come out. Thank you. All right, thank you. Some of us are vision challenged, that's why we wear glasses.
Okay, thank you. Okay, so next up is the Office of Recipient Rights and Customer Services. So one of the key accomplishments of the Office of Recipient Rights included participating in the State of Michigan's triannual assessment of the program. The ORR team prepared the files for audit and completed hospital policy reviews for 13 contracted hospitals. The ORR team also launched a 10-month training series for supported decision-making practices. And finally, as part of the process to increase peer support and therapy options, the peer work group developed goals for FY21 and reviewed data findings, finding that 1 out of 3 providers met the peer support incentives. Some of the work still in progress includes the agency's broader quality assurance efforts, such as developing benchmarks and creating customer service data reports. The team has also been making progress on redesigning and implementing a new background check process. So those are the highlights of the ORR and Customer Service Department, and I'll pause for any questions.
Ms. Bernard has a question.
Go ahead, Hadass.
Thank you. So I didn't understand E on the last, on page 42, the last in progress summary. Services and supports, peer and therapy services in progress. Determine, encourage role for peers at OCHN discussed at work group meeting. Can you expand on what that means?
Francis, you want me to take that?
Is
So-
Vicki on?
Yes, can you hear me?
Yes.
We have a peer work group, and we've had one for a number of years. Each year, we develop our goals that we look to accomplish in that fiscal year. One of the goals was that we wanted to promote peer services, peer activity, peer involvement at OCHN. We only, towards the end of the fiscal year, started to delve into that goal, so we did not accomplish it fully.
Okay, it's a great idea, and I think it's wonderful that you're doing it. Thank you. I just didn't understand what it meant. Thank you.
No problem.
If there's no other questions, we'll go on, but, all right, Ms. Vicki, the one about the peer support, the ones that didn't make the, incentives.
Yeah, so it's interesting, Ms. Newman, that you asked about that. We don't have the fourth quarter data yet because it's sort of a lag, but based through the first 3 quarters, it appears, so there's 2 incentives related to, and Jillian can jump in because Jillian oversees the contract as well. So there's an incentive, first incentive is a $7,500 if the agency provides 25% of the persons they served with a peer service 2 consecutive quarters. Then there's a second milestone of another $7,500 if they do that 35% for two consecutive, 30% of the folks they serve get a peer service. The only agency so far that has met that is CNS. So they did accomplish over 25% for the first 3 quarters. Easter Seals and TTI did not. But if we look at some other data, and it's 2 components. There's the targeted case management program, and then there's also the specialized residential. Healthcare did meet the incentive for both of those. The specialized residential, they actually met the second milestone as well. TTI and Easter Seals did not meet it for either one. The interesting component to that is when you look at other data and you look at the length of the encounter, the average length of encounter that an individual gets at CNS, it's much lower than what TTI and Easter Seals provides. So we have to have some conversations in this coming year about what that really means. What do these 2 data points mean, and what should we do? What should it look like? And why is there this disparity between, we've got one agency meeting the 25% related to the number of persons served in peer services, but then we have 2 agencies who provide longer encounters for peer services than one of the agencies. So we need to have some discussion and try to figure that out. And Jillian, I don't know if you have any additional information.
Nope, nothing else to add.
Does that help, Melkaya?
Yes, thank you.
Okay.
If there's no other questions, you can go on with the next section.
Okay, thank you. So the next department encompasses 3 very large program areas, substance use disorder, access, and justice initiatives. So the first slide highlights some of the key SUD team accomplishments, including expanding the network's capacity to provide medication-assisted treatment to serve 80 to 100 more people annually, as well as to implement a new biopsychosocial assessment throughout the entire network. the SUD team also implemented a process to respond to requests for assisted outpatient treatment within 30 days per Kevin's Law. Highlights for the Justice team included successfully embedding a co-responder clinician within 3 police departments, and also expanding SUD and social determinants of health supports in the Oakland County Jail. And the next slide includes some other accomplishments. There was a lot to cover. High level, the Access team cross-trained 7 staff to conduct multiple types of clinical screenings to provide that service for people when they call, and also participated in more than 10 public presentations and speaking engagements throughout the year in order to increase the public's understanding of the mental health system in Oakland County. And then next, for the work that's still in progress, the Justice team will provide cross-system training for law enforcement under the Crisis Intervention Team model, and will also continue developing a tracking system for individuals who are transitioning back into the community. The SUD group is continuing to coordinate with hospital leadership in order to establish partnerships to address SUD needs in emergency rooms. And the Access team will continue cross-training staff to be able to conduct multiple clinical screenings. And this is to reduce the burden on persons served who might be calling and looking for different types of services. So I'll pause for questions for the SUD Justice or Access teams.
Any questions?
This is John Paul. I have a question about the adult diversion programs. I believe at one point or another we were involved or were helping fund some of the specialty court initiatives with Oakland County, i.e. like the sobriety courts. I'm not sure what specialty courts that they have now, but generally the courts have mental health courts, substance abuse courts, or substance use courts, veterans courts, those things. Are we still involved in that in any way, or are we collaborating with the courts on that?
Is Megan or Siri on the line to provide an answer right now? And if not, then I can circle back later.
No, I'm on the line. This is Siri Sakura. At least to speak on behalf of the Justice Initiatives, we do have a liaison that's embedded in the Adult Treatment Court, so that is on the circuit level. We also have a liaison that's embedded in the Behavioral Health and Wellness Recovery Court through Oak Park. So those are both mental health and co-occurring oriented. When it comes to the sobriety courts or veteran courts, I would probably defer to Megan or Trina to talk a little bit more about that.
Hello, this is Megan Phillips. When it comes to adult treatment court, we do have a representative that sits on adult treatment court for substance use disorder needs. We also have, and that is at the circuit court level, and then also sobriety court at the district court level with Waterford. We also have an individual that sits on the sobriety court there. And then our veterans navigator as well sits on one or a few of the veterans courts throughout the county.
And so with those representative court initiatives, they then would direct any individuals who would be in need of services that we could provide those services, direct or navigate them to them.
You cut out right at the beginning. Did you say, I didn't
Oh,
catch the beginning part of the question.
the individuals that sit on these sobriety courts, i.e. mental health courts and substance courts throughout the county, sounds like they're at the district level and then also the circuit level. Those individuals in their capacity, then they would help direct the individuals to the appropriate services that we could provide, correct?
Yes, for both SUD services as well as mental health services.
Okay, good. I just wanted to see if we still have that involvement. That's great. Okay, thank you.
Are there any other questions?
So next up is the Provider Network Team Goals and Objectives. The Provider Network Team, or PNT, completed several significant goals in FY21. First, a process for credentialing and re-credentialing provider agencies was established. Next, the contracts and service models for FY22 were updated and implemented. PNT also worked on creating opportunities for outreach and self-determination, including monitoring self-determination arrangements through data, and also developing a work group with partners that identified barriers to self-determination. Finally, the team developed a process for determining eligibility for a higher level of care for CLS. The Provider Network team continues to work on implementation of the provider credentialing module. This is with the IT contractor, PCE, and the team is also working to expand specialized residential, the work to expand the specialized residential network was deferred to avoid placing extra burdens on the provider network during the pandemic. And this goal will be revisited in FY22. Any questions about the provider network?
Are there any questions about the provider network?
Ms. Bernard has her hand up.
Go ahead, Hadass.
Great. So in the administration operations implement provider credential module, the in-progress summary kind of says two things. One, it says work with PCE. And PCE is who?
They're a contractor, an IT contractor. Jillian, are you able to speak to that more?
Yeah, do you want me to speak to this? Yes. So PCE is our contractor, which doesn't operate, but who is responsible for our centralized system, OCHN. One of the goals that we had in the last fiscal year, along with the information technology department, was to develop a provider credentialing module. And one of the PNT goals associated with that was to have a module that would allow all provider reporting requirements, contract reporting requirements, to be submitted via that module. The module process was put on hold due to other priorities within the organization that PCE needed to work through first. As part of that, so it's on hold right now. And we're reassessing where it may go in the future because we are also completing a contract management RFP in fiscal year 22 that may be able to meet the provider network team needs differently or better.
Okay. And then, so are we changing the provider credential module?
The module
RFP is doing too?
The module doesn't exist right now. So we have provider credentialing processes in place, and the module itself is bigger than just the provider network team. There was one piece of it that was specific to our team, and there's reporting requirements in our contracts for all of our providers. And so the goal was to have a module within the PCE product that would allow every provider to report any reporting requirements via that module. So the development is the development of the PCE module is on hold because there's been some other priorities for PCE within OCHN. And then at the same time, OCHN is engaging in a contract management RFP, which again has much bigger, it's more than just the provider network team, but one piece of that is looking at actual contract management software that may be able to meet that need more efficiently.
Thank you.
Are there any other questions? You can.
Thank you. So next is the Budget and Finance Department, which this year in FY21 also included facilities. So to start, Budget and Finance continue to build out OCHN's value-based purchasing opportunities with the implementation of new SUD service models. As part of the expansion of the service models, the team is also cross-training staff on the models so that they understand the way the models work for better coverage across the team. The team made improvements to the year-end reporting process using Power BI. This was to inform the analysis of payment data. They also selected a new financial software vendor and are making the switch to the new software in the new current fiscal year. For work in progress, some additional objectives are there to build out service models for both self-determination and transportation assistance. So those efforts are underway. And the team will continue improvements on the year-end reporting process to train staff using the new financial software management system in FY22. And finally, the team also began an assessment of the building's boiler system and HVAC monitoring software to determine recommendations and next steps. Are there any questions?
Are there any questions online? I had one question about the funding models. I was wondering, it's probably more for Mr. Landsman, if we're going to have a study session around the funding models, because I still don't understand them, and I'm just one person.
I can answer that.
Thank you, Sheila.
Thank you. Yep. It is on our schedule. It is a scheduled study session that we have it in the planning. I can't tell you what month, but I can get it back to you, but it is scheduled. Mm-hmm.
Are there any other questions? Hearing none, Ms. Francis, you can go on.
Thank you, Ms. Neiman. Okay, so moving on to the Communications Department. So despite COVID, the communications team ensured that OCHN's presence continued to be felt in the community among the partners and persons served. The team maintained an active presence in the media, developing articles and social media posts on a monthly, if not daily, schedule. Staff attended 21 community events and coordinated OCHN sponsorship of 10 more events in FY21. Additionally, OCHN staff participated in 28 speaking engagements for which the communications team developed talking points and hosted, and they also hosted a faith-based roundtable. As part of the agency's efforts to revamp the public-facing website, The communications team retained a vendor to lead the redesign of the site. So for work in progress, as work on the website redesign continues, the communications team is developing content and overseeing the design to ensure an intuitive and impactful final user-friendly product. Are there any questions?
Are there any questions online?
This is John Paul.
John Paul and then Ms. Ruth.
Oh, I just wanted to give kudos to the communications team. You see a lot of OCHN around on billboards, on buses, and the commercials we've seen. I think it's done a good job of getting the word out about what OCHN provides and the resources that we have, especially during this time of the pandemic. The social media presence too as well. I'm often seeing things on social media by OCHN. So I think we've come a long way with just having people recognize what community mental health is, what OCHN is, and what we provide. And I think in the era of the pandemic, with people needing more services, it's important that we have a presence and they know that we're out there. And additionally, with the services that will be needed in Oakland County, with all of the recent events, I've gotten a lot of questions about mental health and services that are available and out there. So I think that we've made over this, I'd say, past few years, a lot of movement towards really getting out there and having a presence, which I think is extremely important so that we can provide people the services that they need, whether it be substance use, mental health, or so on. So, so I just want to give those kudos on that. Thank you.
When is the new website expected to be ready?
Did you want me to answer that, Francis, or Diana? Did you want to take that?
Christine, if you could respond.
So right now our projected launch is March.
Okay, thank you. I was wondering because I remember it was like close to a year ago I mentioned that it was hard to see or impossible to see our access phone number on my cell phone, but I just checked and I can see everything now, so that's great. I don't know when that change is made, but it's good to see that it was. Thank you.
Mm-hmm.
Are there any questions, any other questions online? Okay, Ms. Francis, take it away.
All right, great. So next we have the Human Resources Department, goals and objectives. So the board might recall that several of the human resources goals were discussed fairly recently. First, the department surveyed staff for the Great Places to Work survey as part of the DEI goals. And one result was that 90% of staff agreed that OCHN is a great place to work. The Human Resources team also completed the compensation study and presented the results to the board shortly after the close of the fiscal year. Another accomplishment is that the HR team adopted a new applicant tracking system for improved efficiency and also convened a work group throughout the year to develop recommendations for improving employee work-life balance, both within COVID and then after. So the next work that is still in progress is to align the recruitment and analytics processes within the new website. And the team also completed the compensation strategy early at the start of fiscal year 22, so that is now 100% complete. Are there any questions?
Are there any questions online?
Okay, so we'll move on to the Information Technology Department next. So some of the IT department's key goals and accomplishments included incorporating the new behavioral health home model into the electronic health record system and OCHN. The team also transitioned all dashboards to Power BI for greater transparency and efficiency across the network. Another major accomplishment was the replacement of OCHN's database server. The team continues to focus on ways to modernize OCHN's IT infrastructure, including identifying options for data backups in an emergency. IT is also working with the clinical team to identify options for obtaining data on lab results to improve healthcare coordination and integration, and is also participating in the website redesign.
Are there any questions? Any online? No? Ms. Francis?
Thank you. So next we have the Legal and Procurement Department. So within the department's key goal displayed here to develop a bid schedule, there were several objectives, all of which were achieved. The team successfully created a bid schedule for all of the value-based contracts. And a couple of key goals for the year were deferred in order to minimize the burden on the provider network and internal staff as the pandemic pushed other priorities into the foreground. The team will reevaluate the approach for developing an RFP for value-based residential services in the new year, and also for implementing a document management system. Pause for questions. Okay, so moving on to the quality team goals and objectives. As the quality team continues to drive quality improvement efforts within OCHN and across the provider network, they achieved several key goals in FY21. As part of the requirements for the state of Michigan, the team developed baseline data and also achieved compliance with most indicators for the indicator system in FY21. Also, as part of the state requirements, was the audit for the Office of Recipient Rights. Next, just last month, the team analyzed the results of the member experience with services and presented the final report to the board. The quality team also continued to work on compliance with the NCQA standards, the national accreditation, for the upcoming review, which will take place in May 2022. And then a few of the key outstanding areas for the quality team include finishing up a process for reviewing and achieving compliance with the state's HCBS, or Home and Community-Based Services requirements. And then at the end of FY21, the team was also finalizing the year-end reports for the state's Quality Assessment and Performance Improvement Plan.
Are there any questions?
Okay. And here we can move on to the training department. So the training team's work has strong and very clear impacts on the people served in the provider network, and the accomplishments this year were numerous. These are just a few highlights. There were 73 new hire rights trainings for over 3,400 people. Annual rights updates provided to nearly 5,200 individuals. There were 50 trainings held for 450 persons served and their peers. Direct support professional training was provided to more than 9,000 workers. 2 person and family-centered planning trainings were held for 30 people, and 18 webinars for supported decision-making were held in a series for 492 people. Additionally, the department held 12 DEI trainings serving 535 individuals and held 2 pilot trainings on implicit bias in healthcare for 78 people. So the team evaluates the needs and effectiveness of the trainings as they go. 94% of people who attended the trainings and took the survey agreed or strongly agreed that the objectives of the trainings were met. So work in progress includes the development of a learning management RFP and an assessment of staff's IT capabilities to inform any gaps in knowledge. And the team is also working on offering professional development opportunities for OCHN staff. So I'll pause for any questions, and this is, that was the last department in the series.
Steve?
Thank you for the presentation. It's a comment, not a question. And it was nice to see that a lot of the objectives that were in our strategic plan are completed at 100% already. We still got a year to go on it, I think. So congratulations to everybody that put in all the work.
Any other questions or comments for Ms. Francis and the staff? Huge accomplishments. Thank you.
Thank you. Yeah, just to wrap up, as we are looking back on FY21, we're also looking forward into FY22. We're planning to review the lessons learned from this year to see how we can improve the process going forward. That might include figuring out ways to narrow down or further quantify objectives. For example, ultimately the goal is to use this process as a tool for monitoring progress and for making internal improvements throughout the year. Additionally, we will look at ways to incorporate the lessons learned into the next strategic planning process, which will launch in the new year with a needs assessment. And so with that, I would like to conclude the annual report presentation for FY21. And again, thanks to the board and to Ms. Lassenby for the opportunity to present today and for providing your thoughtful feedback.
I just wanted to thank Francis for all the work of pulling this all together, Mr. Richard Odaker in the last couple of weeks of pulling this all together. But one of the things I'm so proud of about our team is that I asked the question after the presentation was in its final draft form of the departments to comment about how have we really impacted the lives of people we serve. I know we can report a lot of numbers and goals and objectives, but each and every department was able to talk about, even facilities talked about the work that we do and how it impacts people we serve. So I want us to pull those comments together and bring them back to this board, or at least share them with this board, because to have an organization able to report numbers is one thing, but to really think about what we're doing for this community, I'm very proud of our team to be able to do that this year. So that's all I want to say. Thank you.
Thank you, Dana. Are there any other comments or questions? Ms. Francis, you did an excellent job. Thank you. Next on the agenda is other business. Dana, you're taking the Oxford?
Yes, this last week, it seems like it's been going on for quite a while. We have been part of the first responders team to the Oxford school tragedy. And I just have to say, again, I'm so proud of this team. They just stepped up and jumped right in from day one. So as soon as we were made aware of what had happened at the school, we had a crisis response team, our vendor, Common Ground, go to the school with 3 crisis counselors that very first day. And the next morning, Christine and I and Kim and Adam Hamilton, and Jillian, we all showed up at the school again, the middle school where there was a meeting. And so since that day, we have been on the ground, boots on the ground, crisis responding, coordinating volunteers of crisis responders. So it's just been a very, of course, tragic event to see how this has truly, truly impacted our community in such a horrific way. But to see the community mental health step up and really be able to provide that community benefit has been amazing. And to collaborate and coordinate with all of the partners and follow the lead. I actually follow the lead of the Oxford school district. We have to follow their lead because, they're the ones who are really hands-on in there with the school, with the students and their families. So just to give you a little bit of update, like I said, we were immediately on site. We've been involved in it. Christine Burke, I don't think she slept since last week, but we've been coordinating the activities, bringing the volunteers together who are actually clinicians who are trained in crisis response, and then having a schedule and being able to meet the needs of the school has been our priority in the last week or so. I don't know if we've done a lot of anything else, but really focus on this. The other thing is we have had work with the county exec's office, and the Board of Commissioners have been extremely supportive. Michigan Department of Health and Human Services, of course, wanted an immediate update and offered their support in what we do. And then on Friday, I think it was, Governor Whitmer put out a press release with the number of where families can call to get crisis help and support. So we're looking at a phased approach. So we're there immediately, of course, and then how do we continue to support individuals in the community and the schools? And then as time goes on, we know this is a long path, but as time goes on, we'll continue to make ourselves available for people in the community who need our services and supports, but also working very closely with the health department. And there are 3 or 4 events this week that are occurring so that families outside of Oxford can also receive help, because we've seen some of the impact in that you've had other threats that have come up, which is just disbelief. I'm sorry, it's such disbelief, but we want to make sure we're supporting those communities in the surrounding areas as well. I know we had a question from Mr. Torres about how we are supporting law enforcement community, and actually they have their own crisis incident stress debriefing professionals who are trained and are doing that work. We are, like I said, we have to follow the school's lead. They have their own crisis response plan, and we're just doing the mental health portion as much as that we're required to. I have to give acknowledgement and thank yous to Common Ground, to Honors Health, to Easter Seals, and our providers have really stepped up. And all of our providers actually have provided us with a thorough list of over 100 counselors who have made themselves available around the clock, and we've been scheduling and coordinating to help with the response. Not one organization can do it on their own, and I think our providers found that out very quickly, because we have 1 or 2 that were actually already working with Oxford schools, and we know that they've asked for us to really, help with the coordination to the point that we've had to centralize it. You can't have just one entity doing it. It has to be centralized where we're working with all of our providers. So I'll take any questions. That's really been our focus in terms of any update I can provide to you. And I apologize for being late, because again, that was part of our response to the community and making sure that we're answering questions. Really working gently with media. We've had some reports where students and families have almost felt harassed by media. So we're getting those questions, and we're hoping that we can sort of change some of that narrative where we're providing some kind of protection of children by talking about, you know, this is not a good time to put a camera in a youth's face after they've been through such a traumatic event. And any of us, just imagine how any of us would respond or feel about that. So really our children, that's our first priority, is looking out for the youth in this situation and making sure that they're understanding the psychological, mental impact of what they've been a part of, and that we be sensitive to that. So like I said, I'll take any questions that you may have. I'm looking at my notes, making sure I haven't left anything out. But we know this is a long path and that we will be a part of it for a long time, and our role may change as time moves on. I know that the school is looking at for some things that they want to do on their own and how they handle that as well.
Are there any questions for Dana? Oh, Dennis, sorry.
Thank you very much for that update. And obviously, because of the situation that developed, there was reactive actions. I guess just a question in my mind, and probably because I'm new, so in terms of the mental health of students, I know usually we get issues that come up relative to suicide and perhaps issues relative to aggression and violence. So without getting into the weeds about this situation, because we've probably seen this kind of profile of a person in other places, what can be done to provide support to school districts and to, if it isn't being done already, and it may well be, I just don't know, what kind of support can be provided to identify maybe students who don't fall into these buckets that of aggression or suicide? Because I understand those are the most common problems they have to deal with, but how does that, what kind of support are we giving or can we give?
You know, I will defer to Dr. Posios or Kim Flowers. And again, I'll tell you, education is and training is so important. And one of the first things that we encountered when we went to the school meeting on Wednesday was the amount of support that was in the room, but also the fact that, you know, they acknowledged very early on that a lot of lives were saved because kids were trained. So you can't discount that at all, the number of lives that were saved. But the other thing is recognizing how to recognize when somebody is struggling or having a problem. And so that community education and training is critical. And then really one of the things that we have put forth with the Board of Commissioners as well as the state is a mental health navigator for the schools. And so there's been talk here and there about independently different providers doing it, but I really, really think we need a collaborative approach that starts and centralized with us so that we can really respond to those questions, and even just a concern from an administrator standpoint, from a teacher, from a parent, or even a youth themselves, that they could call and just to ask a question. And so I'll let Kim jump in there, but I think the education and training piece is the critical piece going forward.
So, thanks, Dana. I do agree there is must be education and training, but I think we've done some of that. Some children, as you say, are not going to act out. They're going to just get quiet.
Right.
But their behavior will change, and we have to make parents, students, and anybody who touches their lives understand what that might look like, and understand when a child's behavior changes, and explain all of the possibilities or all of the presentations that might come after this. Because, you know, it could be quiet now and angry later, angry now and quiet later. Mm-hmm. It can change. So the most important thing is to be in front of the parents and the teachers and the counselors and anybody grandparents, anybody who touches a child's life. So what we're doing is We've been out there, as Dana said, boots on the ground, discussing and talking and sharing, mostly listening, because it's trauma. Everybody's traumatized right now. So it's a lot of listening and understanding and feeling with people, and then providing resource. But that's just the first step, right? So you're doing all of that, and in the background, you're still sharing resource. You're still having conversations. You're still offering opportunity. And I think that's, we've even talked about this with the Tri-County area too, and how to work differently and as a strong, unified group coming together to talk about our children's services in general, right? What are we all offering children? What are we doing differently? What are you doing that I'm not doing? What am I doing that you're not doing? But I think it's a collaborative effort with students, the teachers, the school districts themselves, and the county in general, and what they allow us to be able to do in the schools. I think one of the things that we had come up, we said something about in our discussion with Tri-County about education, but we've been doing that. Right? The education has been there, but also in schools specifically, you need maybe more supports in the schools. We have a navigator we're talking about, but one navigator is not going to make the entire change. It's a step in the right direction. I think we need a system that's bigger and broader that can support the schools in the area, and maybe even, and I dare I say, just the schools to themselves identify this as an important need, and then expound on services on their end that then hold hand with services on our end, and we come together and continue this education and this effort, not just right now, but going forward. I think this will be an opportunity to expand those services. Everybody can see that they're much needed at this point.
Yeah. And if I could, just as a follow-up, and that's important to know, and I appreciate it. When I say schools, I mean generically schools and parents. Because I'm going to tell you, starting this week at every board meeting in this county, parents are going to get up and say, what are you doing? Those elected members and the officers and management of the school districts, because parents are going to say, what are you doing? What are we doing? Okay, to make sure this doesn't happen. So we've unfortunately, through a tragedy, come to, for lack of a better term, a teachable moment, and it's not just a moment; it's a long-term type of issue. And I just see that I'm sure we'll provide those type of support if we're asked to participate or to be proactive and find out how we can partner with the various school districts and parents to come up with solutions, or at least identification tools, so that perhaps this could be avoided in the future. So,
sorry, if I could respond to that as well. Prior to this tragic event, one of the priorities we set forth was developing a system of care for children. This was an issue before,
right.
And so we need a system of care. I was on the phone today with a parent and just frustrated because they have gone to multiple places to seek help. And so when you're in crisis, it's hard to seek help when you're in crisis. We have to have the other pieces of the system that fill in the gaps. We can't say mental health services are available, but if you only need this, then you can go here. We have to have a full continuum of care and services. And so it's going to cause us to really look at what that looks like and make an investment in those services so we don't have to try to live through another tragedy such as this. And not to say if we could have everything in place, and I don't know if we wouldn't have had the same outcome, I'm sorry, but it really does call that we look at our system of care for children. It can't just be one place. It has to be an array of services that are available. Every child that knocks on our door, family that knocks on our door, doesn't need extreme services, but we have to meet them where they're at. And right now we have good providers out there that are doing the work, but we have gaps too. So we want to fill in those gaps as much as possible.
Okay. Thank you.
Oh, I think Dr. Posios was going to speak to that as well.
Thanks. I just wanted to agree with what's been said by both Dana Lazenby and Kim Flowers, there are some things that I think that we can do concretely that can help teach teachers and school administrators to recognize mental illness, but perhaps more importantly, help them understand how to make appropriate referrals. But really, the thing that I struggle with is how do we sustain support for reform 6 months from now, a year from now, 2 years from now, when we're not in the aftermath of a crisis. That's really the challenge in my eyes. And I don't have an answer for that other than to just keep plugging away and doing what we're doing in terms of making it known to the community and to the school board and the county that we are here, we are a resource, and we can help.
Thank you, Dr. Posio and Kim and Dana for your comments. It's kind of hard for me to listen to this conversation because my job is community education. Right. And I've been doing it for 16 years. And the schools are one of the hardest places to get into. And I understand needing to protect the kids, but sometimes we protect them too much. And we don't let programs that could benefit them in. And that's at the ISD level. That's at the school board level. I've talked to superintendents about my program, and they have said to me, we don't want you coming in talking about suicide prevention because you might put the thought in the kids' minds. They don't understand. So my comment is we as individuals need to have the conversation with our friends, at our places of worship, at the doctor's office. We need to make the conversation more common about mental health, because especially with the pandemic, people who never had anxiety issues before are having issues with anxiety and depression. So when are we going to normalize these conversations? And there's parents, I've had kids that when we did get into some of the schools, the kids would tell us, we want to get help, but our parents won't let us. They don't want the stigma of something is wrong with my child. Back in the day, they used to blame parents. Well, is something wrong with your parenting skills that your child is acting this way? We're a lot more enlightened now, but the stigma is still there. So we, board members and staff and all the staff, anybody, bus drivers, everybody, we need to normalize the conversation around mental health and make it less scary, especially for parents. And that's one of the reasons why when we are able to speak, it does make a difference in people's lives, because you can see a person who has a diagnosis that's living an extraordinary life, and we're doing that, and it gives people hope, but they have to hear it, they have to see it, and it's available, and OCHN is sponsoring this wonderful work. You approved my contract.
We have 3 hands up online for board members.
I'm sorry.
No, you're fine.
Who's first? I don't know.
John Paul.
Hey, thank you. I wanted to touch a little bit on what Dana said with all the resources. And usually when we see a tragedy or something happen, there's a lot of resources and everybody wants to help. But I understand the approach of just stepping back a little bit and then letting, in this case, the schools guide us with what's available. On that note, Melchiah makes a good point. I sat on a school board for 6 years, my local school district, and it is hard oftentimes for people to get into the school, and a lot of times for the reasons that Melchiah was saying, and that was one of the things that often frustrated me with having people come in and talk about these kinds of things. And so sometimes the schools, need to be guided a little more. And so maybe that's something that if we ask and maybe we get a no, or then we ask a few more times until we actually get that yes. But I really liked, and I think that was from OCHN. I saw in the Oakland Press some bullet points that were given about this is what you can do to get services if you feel that you're having problems, kind of thing, which gave guidance to the greater community. But one of the things that kind of struck me that Dana had said is about like the media, and I think it was something along the lines of informing the media that it's probably not the best thing to stick a camera in a kid's face after something traumatic has happened. And I go even a little further and say that if there's something that we can do as an organization, even if it's a bullet point, something through our communications department, but to help parents talk to their kids about what happened. And I'll just give you my example of what happened. I have a 7-year-old, and my wife and I were talking about it, and my daughter started asking questions, and I was trying to explain to her, but I was struggling to try to explain it to a 7-year-old. So I realized that, as I was getting further into the conversation, I need to step back, reassess with my wife, and then, talk about how we're going to approach this. But I think, that experience is emblematic of how do I talk to my 7-year-old, my elementary, age kid that doesn't understand that, the world isn't as nice of a place as she thinks it is. How do I explain that to them? So if there's anything that we can do with our expertise, through OCHN to provide some kind of community resource, even if it's something we give out to the Oakland Press or give out to the community, to help parents like myself talk to their young kids about these situations. And one of the biggest things that I had gotten is because I was on the school board, I'm still friends with many of my fellow school board members, and I was asking them about the ALICE training and about have we done our ALICE trainings, and my daughter's in 2nd grade now, and she hasn't done that. Mind you, we've been in a pandemic a year and a half of those 2 years. But how do kids not be scared of the ALICE training? How do kids not be scared of having the shelter, and maybe the approach that we do with when there's a fire, they come and they know what to do when there's a fire. And my daughter always says, don't hide, go outside, kind of rhyme thing that she knows to do. So maybe there's something like that once, this further down the line, maybe we can get into the schools and we can work with the kids, or we can work with the families to help them, explain them to their young ones. Because I think there's definitely a need for that, because I know I struggled with trying to explain it to my young one without going back and reassessing and figuring out how I was going to explain it. Thank you.
Mr. Torres, we have put out tips for parents to talk with their children. The hard part about it is it's unexplainable to us as adults, so it's even harder to talk to our kids about it. But there are bulletins that are out that have started coming out as of last Wednesday, I believe. First thing Wednesday, we sent out tips for parents to speak to their children about what had happened. So we'll share that with the board, make sure that anything we send out as it relates to this that you all also get.
There were some other hands up online.
Mr. Landsman and Ms. Bernard.
Mr. Landsman?
Thank you, Melchiah. So it's a challenge that you've heard Dana talking about and others talking about. There are 27 school districts across Oakland County, not counting the intermediate school district. There's 1.25 million people in this county. There's all kinds of social issues, psychosocial issues, and other kinds of challenges that are out there, and trying to craft the right messages and trying to do it in a way that works for every audience is almost impossible to have one message that works for everything. There is no panacea. There is no silver bullet that's going to work for every case. And it's tough. I'm a parent. My kids are, definitely grown and have their own kids now. But in this day and age, the parents have the control, but they don't have the tools. They don't know exactly, as John Paul was saying, what's the right message to use at what age level. And there's, especially after the shooting, if I were to say there's 100 different sources of folks that are offering solutions, messaging, direction, I'm probably under exaggerating, not over exaggerating. Just how many people are trying to step in and offer help. And what is missing is some sort of clear command and control kind of thing that would help coordinate the types of messages so that people know, if it's about elementary school kids, then look at this series of them, because here's 5 different things. Choose the one that you feel best suits your situation. There isn't any coordination of that, or for middle school, or for high school, or for adults, or other issues that are still not, that have not gone away, that maybe led to some of this, like social issues, social interaction, bullying, suicide issues, substance use issues, just the usual, social circles that grow up, in high schools or in junior highs. Middle schools. There's so much of the dynamics. I don't know how anyone can wrap their heads around this, but I do recognize that we've done an excellent job in putting our feet forward and being in that mix from almost minute one. So I just wanted to take a moment and thank you, Dana, and your team for stepping up and being that, being at the side of the county to help them, with things that you guys know and do as professionals, even if this isn't exactly the situation that we're used to working in. So I just wanted to say thank you.
Hadass, you had a comment or a question?
I just wanted to thank you also. You've done a terrific job. The team has done a terrific job, and it's gonna, like everyone says, it's going to continue, and we have to figure out how to keep it at the front of people's minds and get into the schools. But I don't want to repeat what everyone else said. I really just wanted to say thank you.
Thank you, everybody, for your comments. Christine, you have an update on communications?
I do. As Dana said, for the most part, we have pivoted toward response to the Oxford crisis, and just want to add in, and for all the challenges that we've mentioned and seen, we've seen so much progress with collaboration and community support. And one of the things we said very early on, and that boots on the ground right away, and that didn't just mean going to the school, that meant people delivering resources to faith-based community, to funeral homes, to florists, to grocery stores, that we really did as much as we could to be present, and that the volunteers and people who have stepped forward is just abundant. So, there's collaboration with our providers, collaboration with Oakland schools, collaboration with Oxford schools, and being as responsive and respectful as we can to that community during this time. This is the list of events we had planned for December. December is usually our quiet month because we start planning for all of our events in January. So there are some other things that we have planned for January. Dana is scheduled to give a quarterly update to the Board of Commissioners. That was supposed to be in December, but the Board of Commissioners had changed that. And then we are going to be hosting the hospital liaison community meetings. I believe it's on a quarterly basis, but the next one is January 12th. And then there are the 3 community mental health events that we are hosting with the Oakland County Health Division. So tomorrow from 2 to 7, we will be in Oxford. And then on Wednesday from 2 to 7, we will be in Pontiac. And then on Thursday from 2 to 7, we will be in the Oak Park Southfield community. There are some flyers and press releases and information that are being distributed. I'm very grateful that our partners were making recommendations and they're taking the lead for us, because we do need to focus on the Oxford community now. So the health division offered, when we brought this up, they offered to take the lead and help us coordinate it. And it's really just all hands in has made a difference for the community and for the school. That is all I had, unless you had any questions.
Are there any questions for Christine? Thank you, Christine. Now it's time for our second opportunity for public comment. Do we have any public comment?
Checking the online form, I do not see any public comment for this evening.
Thank you, Suzanne. Now it's time for board member comments. Can you call the roll, please, Ms. Sheila?
That's me. Ms. Bernard.
I just want to thank everybody for the meeting, and I kind of already made my comments, so just saying thank you.
Mr. Furman.
Yes, I'd just like to say thank you to all the departments and staff that helped to put together the annual plan overview. It was really good information. It was also provided succinctly and it was easy to understand. Thank you so very much to the network that's assisting with the Oxford situation. We also heard mention of that last week with regard to the Metro Regional meeting, just the outstanding job that the community has done with coming together and providing these young individuals with the support that they need. But Dana said it well too, that this isn't the time for interviews and media intervention, and I was glad to hear Dana say that tonight. So once again, thanks for all the hard work, and thanks for the continued hard work with dealing respectfully and appropriately with this Oxford situation. Thanks, and have a good night.
Dr. Guadalupe. Dr. Hans. Mr. Landsman.
Thank you. I want to thank the staff for all their work, not only in working in the outreach, the activities around Oxford and the other communities across the county, but also on this annual plan report in preparation for building our next strategic plan, which is, I think it's due this summer. I'm hopeful that while we have 6 areas we focus on, that we have 20 annual goals, I'm hoping that perhaps we don't have 280 different objectives in the next strategic plan, that perhaps maybe we have 40 or 60 objectives that tie to those 20 goals, only because it seems like a whole lot of difficulty to focus on some number of things that one does versus saying we have this many and we're making this much progress on it. So I'm hoping that we have less overall that we focus on and more depth of those, if that's possible. But either way, I want to thank the staff for putting this together, tracking it all, and trying to make sense out of the strategic plan. And I know this goes back to Kathleen Kovic's efforts of putting together originally and in prior years as well. So, like I said, just hoping it gets simpler. Again, thank you all.
Mr. Cowan?
Thank you for all the responses this evening to our inquiries.
Ms. Root? I appreciate all of the information that was reviewed tonight, and thank you to everyone who's been a part of the Oxford response. Please remember that secondary trauma is a real thing, so do what you need to do to take care of yourselves. You know, when you're on an airplane, there's a reason why the flight attendants say put your own oxygen mask on first. So please make sure you're doing that, because we need to be okay in order to take care of others and make sure they're okay. So, yep, just remember that. Thank you. Have a good night. Dr. Todd?
Yeah, not to be discouraging, but the intermediate school district, except for the autism, I believe that we're responsible for kids up to the age of 6, and then after they're 26, in the intermediate school district is responsible for their well-being the rest of the time. And over the years, outside of a crisis situation, they're extremely territorial. They're going to reject, well, they have, been my experience in 19 years, they've rejected almost anything we suggest, not based on even knowing what it is, just based on the fact that they're in charge. And I just don't know of any way to get through that barrier. And I think that's what Dana means when she says, well, we have to let the schools do what they want. Well, we do, but we should be working with the intermediate school. And there's a movement, too, to change that age range down to 21, I believe. Is it still 21? So that might be a good thing, because I don't think a person at 26 that's been under the ISD's care is prepared to go out in the world on their own all of a sudden at 26. Maybe if we start at 15 or 16 or something. So, like I say, not to be discouraging, but I've seen nobody being able to just get through their resistance to anybody working with them. That's all.
Mr. Torres?
No comments, thank you.
Ms. Newman?
I just want to thank everybody for bearing with me. This is my first meeting in quite some time, and I was a little nervous, but I think it went very well. So thank you, everybody. Thank you to the staff. This is such a great group of people, and I'm so privileged to be a part of this organization. You work hard. You sacrifice so much. So I just want to thank you all for all your hard work and your labors. It is not in vain. Thank you so much. Have a good night, everybody. This meeting is adjourned.
Good night.